In coronavirus news this afternoon, Wisconsin is beginning to see a steady decrease in daily COVID-19 cases. The state reporting lower numbers for the past 5 days, but a slight increase today. Regardless, these numbers are still much lower than what we've been seeing since early January. And joining us this afternoon is Dr. Joe McBride with UW Health. Joe, thanks for being with us, doctor. And let's talk about this. The numbers going down a little bit here. I know everybody's really hesitant to give an answer to this question, but have we seen the surge already?
Yeah, I certainly hope so. I think what we saw at the end of December and early January was really a combination of a really transmissible variant, the Omicron variant, and then the combination of all the holidays. You know, in 2020, we weren't mingling and we weren't grouped together in this kind of way that we've done this year. We were really hungry to get back together. And I think because of these two things, a transmissible virus and a lot of these gatherings led to these very high levels. So now that we're seeing some of these gatherings go away and these levels go down, I think it's a really good trend.
So how do we move forward from here, right? Before we hit this, the next variant that we're going to see and be in this same situation? Or does it look like every time we get a different variant, it's less lethal? We don't know that, right? The next variant could be more lethal.
You're absolutely right. We really don't know, and trying to predict variants is like trying to predict the weather. You know, we have a good idea of how some things might look, but at the end of the day, really hard to make good forecasts weeks and months ahead of time. What I will say is that variants will always occur, but vast majority of them will not be more dangerous. We also have some new tools available to us. We have some new oral antiviral medications with the idea of keeping people out of hospitals. We have a better sense of the disease in itself going into this in 2 to 3 years at this point. And so things are just a little bit easier from that front. So I'm going to remain optimistic.
You talked a little bit about the tools there. I want to ask you a question about the monoclonal antibodies. The FDA kind of removing their emergency authorization, saying they don't work so well with people with Omicron versus maybe Delta or some of the past variants. First of all, how do you know that when you're treating somebody, what variant they have? And this wouldn't be something you'd want to try at least.
Well, there are various different types of monoclonal antibodies, and some of the ones that we've used earlier in the year are not really active against this strain. You bring up a really good point in that when the physicians are evaluating patients, they rarely know at hand what variant an individual has. But we're able to follow general trends that are reported from the state and county levels. So we have a really good sense what is circulating in the environment. And we know far and away here in Wisconsin, Omicron is the predominant variant that's circulating, and Delta and some of the others are really the minority.
And
so even if we don't know from the patient, we have a good sense of the trends.
Yeah, you also kind of know, I guess, how it's affecting the patient, which one it might be as well, too.
It's really hard to know, just by seeing an individual, what kind of variant they might have. I think you're really best looking at the population data overall.
All right, Dr. McBride, thanks so much for being with us from UW Health this afternoon. It's always nice to have some clarity on the day's news when it comes to COVID-19 and where we go from here. Thank you so much for being with us. A reminder, you can follow along with the latest coronavirus news just by scanning this QR code on your screen. All you have to do is scan this code. It'll bring you right to our coronavirus page on our website and give you all the information you might be looking for. We'll be back with more news here at 4 o'clock right after this.